Okay, welcome back. Good morning to all of my dear viewers. How are you? सर कैसे बताएंगे कमेंट करके और कैसे बताएंगे Okay, so it's fine. In today's session, I am going to discuss the diagnosis of the malaria and its treatment. So be focused. It is a very important lecture. So we start the lecture with the diagnosis of malaria. So now the question is arise how we diagnosis the malaria. So basically for diagnosis we having two methods. What are these two methods? The first is that we go for the rapid diagnosis kit or the rapid diagnosis test. Okay, so what is the other things? Other things is make blood smear, by MPW. Sir, what is the meaning of this MPW? MPW means multi-purpose worker. Multi-purpose worker. अच्छा वो they having ability to do many work like that. Yes, they are basically a multi-purpose worker. Okay. So first, I would like to discuss which test. According to me, this is more difficult. So we start the topic with most difficult things. Not most difficult. Among this, according to me, this is little bit more difficult. So we start the topic of diagnosis of malaria with make blood smear by MPW. So what the MPW do? This MPW worker, I mean multi-purpose worker, they basically, according to the malarial survey, they go in village, and in village they go in village for every 14 days. So when they go in village every 14 days, they take the blood sample of all the villagers who having a fevers. So what they do, take blood sample. They take blood samples of all the villagers who having fevers. So what they do after taking the blood? After taking the blood sample, they making two slides. One is thick slide. One is the thick slide. Thick slide means they contain more amounts of blood droplets, and another they make a thin slide. So after taking the blood sample, they basically make two slides. One is the thick slides and another is a thin slide. Why they make two slides? This thick slide is for determination of malarial parasites. Means is any malarial parasite are present in blood sample or not. And this thin slide for a specific speciation of malarial parasite. I mean which types of malarial parasites are present in blood sample. Which it is Vivax malaria or falciparum malaria. There are two types of malarial parasite. No, two types. There are four types. But basically in India, two are common. One is falciparum and another is Vivax. So basically they try to find which malarial parasite are present in blood sample. It is falciparum or Vivax. Okay. So now the question is arise how they find that malarial parasite is Vivax or the falciparum. Okay, so it is basically a microscopic study. What is the meaning of microscopic study? Microscopic study means observe things under the microscope. Okay, so what they do, this multi-purpose worker, after making slides, they observe this slide under the microscopes And what they observe under the microscopes, if under the microscopes they observe some granular appearance inside the RBC. If under the microscope they observe some granular appearance inside the RBC, then they conclude that this parasite is Vivax. Okay, so if under the microscope this MPW worker observed that some granular appearance is observed or seen under the microscopes, then they think that in blood sample having a malarial parasite which is a Vivax parasites. But if under the RBC they observe some headphone shape or banana shaped or concentric shapes, in that condition they suggest it is a falciparum. Okay, so on the basis of this microscopic study, they find that which malarial parasites are present in blood sample, it is Vivax or falciparum. Okay, so this all about the blood smear, I mean a microscopic examination. The other things we are going to discuss, rapid diagnosis test. So what is the rapid diagnosis test? In market there are two rapid diagnosis tests are available. One is the histidine rich kit, and another is lactate dehydrogenase kit. One is the histidine rich kit and another is lactate dehydrogenase kit. Okay, so what are the difference between these two kits? The difference is that this histidine rich kit, they detect only falciparum malaria. They detect only falciparum malaria. But this lactate dehydrogenase kit, they detect both falciparum plus what? Vivax. So according to me, I hope this kit are more better because they detect the both malarial parasites. So this all about the diagnosis of malaria. Now after the diagnosis we move towards the treatment parts. So first I am going to erase my board so I can write the treatment parts on it. Okay. Okay, so let's see. Since we on the basis of this microscopic examination and rapid diagnosis kit, we are diagnosed two malarial parasites now. So definitely there are different treatment in case of the Vivax malaria and the falciparum malaria. So according to me, this falciparum malaria diagnosis is little bit difficult. So we start the topic with falciparum malaria treatment. Okay. So we are going to erase this diagnosis parts because it is over. Now we start the falciparum. Okay. So let's say what are the guidelines for the treatment of this falciparum malaria? There are two different guidelines for the treatment of falciparum malaria. One is applicable for the only for the northeastern states, and the other is applicable for other than northeastern states. So we start the topic with other state except northeastern state. Okay. So what are the regimen given in case of falciparum malaria? We start with artemisinin based therapy. What is this artemisinin? Artemisinin is derivatives which are used for killing the malarial parasites, and we commonly use two artemisinin derivatives. One is the artesunates and another is artemether. So in case of other state we use or in guidelines it is written artesunates. Okay, so what are the dose of this artesunates? In falciparum malaria we give artesunate of dose 4 mg per kg for 3 days. Okay, so in the patient of falciparum malaria, we giving artesunate of dose 4 milligram per kg for the 3 days. Okay, along with we also giving sulfadoxine with a dose of 25 milligram per kg on day first. Okay, this medication is given only for day first. Along with sulfadoxine, basically this sulfadoxine is not come for a separate tablet. They come in combined with a pyrimethamine with a doses of 1.25 milligram per kg. Or this pyrimethamine are also given on day first. Okay, the fourth thing is the primaquine of dose 0.25 milligram per kg on second day. So this artesunate is given for the 3 days with a dose of 4 milligram per kg, and the sulfadoxine and the pyrimethamine it is given only day first, and the fourth tablet, that is a primaquine, it is a dose of 0.25 milligram given on second days. So these are the regimen for the treatment of falciparum malaria in other states. What about in northeastern state? In northeastern state, we are preferred for giving artemether. This artemether is also a derivative of artemisinin. So artemether with a dose of what? Artemether with a dose of 3.25 milligram per kg, and this artemether is also given for 3 days. Okay. Now again, this artemether is not come separate tablets. They come with a combination of lumefantrine. So along with artemether, we also give lumefantrine of a dose of 19.2 milligram per kg for 3 days. Basically, these two tablets are come in a combination with 1:6. I mean 20 gram artemether and the 120 gram lumefantrine. Okay, along with this artemether and the lumefantrine on the second day, we also give primaquine. So these are basically a regimen for the treatment of falciparum malaria in northeastern states and the other states. And now we go for the treatment of vivax malaria. So in vivax malaria, there are two drugs of choice. Drugs of choice are two. One is the chloroquine and another is the primaquine. Now here chloroquine dose is at instant. I mean, when a patient come to your hospital, we start with 10 milligram per kg, and after a start of 10 milligram per kg, in a 6 hour, 24 hours and the 48 hour, we give 5 milligram per kg and the 5 milligram per kg. So in case of vivax malaria, we start chloroquine with at a state 10 milligram per kg. Then at 6 hours, 24 hours and 48 hours, we give half of its dose, I mean 5 milligram per kg. Okay, here what are the dose of primaquine? Obviously 0.25 milligram per kg. But the difference of this primaquine in case of vivax malaria and the falciparum malaria is, in case of you already see that in case of falciparum malaria, we give primaquine only second day. But in case of vivax malaria, we give this primaquine tablet, I mean 0.25 milligram per kg for the 14 days. So why we give this primaquine for the 14 days? Because what happen in case of vivax malaria, there is hapnozoites. So So these hypnozoites are hidden inside the liver. So if these hypnozoites are hidden inside the liver, having chance of relapsing, I mean chances of second time infection. So for killing the hypnozoite, this primaquine are especially used for killing of the hypnozoites which are hidden inside the liver. So that's why we give this primaquine for the 14 days. So this is all about the treatment and the diagnosis of the malaria. In the next lecture, we are going to discuss the clinical features and some vector control methods of malaria. तब तक के लिए गुड नाइट्स. ओके बाय.